Hi, today we're talking about ethical considerations on our limits of confidentiality, which means, during a session with the client, if they begin to share with us anything that we think could lead to a mandatory reporting situation, like harm to self or others, or the abuse or neglect, then when do we, or do we even remind the client of our limits of confidentiality? Now, there is not a right or wrong to this answer. This is a great topic that is usually debated in ethics class, and it's up to us individually to really determine what this looks like. Now, keep in mind that, we also have to remember that we are here for the client, and our job, our responsibility is to do what is in the client's best interest and to do no harm. So what that means to you and what that looks like could be very different. So I'll share with you what that looks like to me and how we handle those situations here. So let's say a client comes in and they begin to say maybe something, they have had suicidal thoughts recently, or maybe something a little bit more vague of like, I just wish I wasn't here anymore. Or maybe they're, leaning towards, maybe a spouse that maybe hit their child or something like that, that could potentially lead to an abuse reporting situation. As soon as I hear anything that could potentially lead to that mandatory reporting situation, I stop the client. I will literally say, okay, wait, stop. I just want to remind you of my limits of confidentiality, right? Because I always want to do what is in your best interest, right? So we don't want to lure the clients in or entrap them in any way. To me, it's not ethical, right, to encourage the client to continue sharing, ask follow-up questions, or even begin to ask questions that we know we're going to have to include in the report, right? This is kind of like entrapment to me. And again, this is just my opinion. But to me, that's not doing right by the client, and it's not, potentially in their best interest. So I always stop the client immediately. I warn them, I let them know the limits of confidentiality. But then with that said, I also try to, normalize things for them and tell them that it is important for them to share. And if in any way that if I did need to report something, that it would be in their best interest, and that it would be something that I would discuss with them. And we're going to talk about this more when we go into, I have an episode coming up about suicide risk assessments, and just dealing with also separate episode of dealing with a mandatory reporting situation with the client in session, because I am a big believer that we should discuss it with the client and try to get their buy-in and agreement to it. So they are part of the process, and it's not like us acting against them. And so I will go into detail about how to go about that in therapy with the client. So one thing is to just kind of normalize. Let's say it's, let's use the example of suicidal thoughts, or like the passive thoughts of not wanting to be here anymore. We want to normalize it for them, to just encourage them to share. And this is, of course, after we have already let them know about our limits of confidentiality, right? So, because the reality is there is a big difference between having suicidal thoughts and actually attempting suicide, right? So, and unfortunately, suicidal thoughts is a common symptom of, depression. It could be a side effect to medication. It is sometimes, depending on their history, a common thought when faced with a challenging situation, or when triggered about something. So we want to normalize that a little bit and let them know that, hey, it's okay to have the thoughts. And the healthiest thing is to talk about it, because that is true. As long as they are talking about it, that's actually a protective factor for us, right? It's when they don't talk about it that it's that they're at more risk. So, we want to tell them, look, having these suicidal thoughts can be normal for what you're going through and for what you've experienced in life. So let's talk about it. As long as I have to believe that that you're going to leave my office and go try to attempt suicide for me to report it, because you also want to create a safe place for them to share their thoughts without the fear of it being reported and then being like, they think they're, to them it's like they're going to be locked up. So it's a balance. It's a difficult balance, but you want to ensure first that they're not actively suicidal. And again, we will go through this step by step, very specifically in the episode about suicide, how to do a suicide risk assessment. But after that's done, you want to, again, just normalize that. Give them a safe place. Remind them, say, as long as I don't believe that you're going to go leave my office today and attempt suicide, you're fine. It's safe. We can talk about it together. But I have to tell you, if I do feel that you are at risk, I'm going to have to talk with you more about it. And if it does come to the point where I do feel that you are at a high risk and that you have the probability of doing it, I am going to have to report it. But please trust me that it is for your own safety, right? So these, and never ever are limits of confidentiality a consequence, right? It is always for their own safety. Please don't ever use those limits of confidentiality as a consequence or even a threat. Right? I have seen therapists, I've heard therapists do this. It's not right, and it's not in the client's best interest. And all we're doing, in my opinion, is damaging that trust and ultimately that relationship, the therapeutic relationship with the client. And then the client has nobody. And if they are reporting something as serious as something that would be a mandatory reporting situation, then that means they need us the most in that moment. So that's not the time to, really shut down and kind of go, I got to report this. And I've seen that. So think about where you lie on this topic, and maybe even talk about it with some of your colleagues. It's a really interesting topic, and the choice is yours.